Effective today, mask wearing is no longer required while outdoors. Additionally, social gathering and social distancing restrictions have also been lifted. Although it's welcome news for most island residents, others are still doing it to protect themselves and their families. Lead epidemiologist Dr. Annette David confirmed that the island will be just fine, even with the outdoor mask mandate lifted.
In terms of the risk, uh, when you're talking about outdoor masking, you really want to prevent community transmission. So the things that are important are how widespread is the virus. And we know from the data that that's been going down. So that's really good. And then also when you're outdoors, the ventilation is really at the best it can be. And so that lowers your risk even more.
Guam continues to remain in the low-risk category, and as Governor Lou Leon Guerrero said last night, if the island continues to sustain that category, indoor mask mandates will be lifted as well. But according to Dr. David, it's important now more than ever to remain on guard as the World Health Organization is tracking multiple subvariants of COVID-19.
We were familiar with Omicron 1, which was the original cause of our latest surge, and then Omicron 2, BA.2, which really caused our surge to hang around for as long as it did. BA.1 and BA.2 have somehow merged to create a recombinant variant, and that is the one that people are calling Omicron XE. That's your iPhone update. That's your SARS-CoV-2 update. But you also have in the radar of the WHO, Omicron 3, Omicron 4, and Omicron 5. So they're keeping track of that, of those three. And then in the US, in particular in New York, they are looking at subvariants of Omicron 2. So there's Omicron 2.12 and Omicron 2.12.1. So as you can see, it's not just one variant. There are several of them that are starting to show up.
Dr. David added that Omicron 2.12 and 2.12.1 have been responsible for 90% of the cases in New York. The two subvariants of Omicron BA.2 are also thought to be about 20 to 30 times more infectious than the stealth subvariant BA.2. As for Omicron XE, it has now been found in Japan and Hawaii, but currently it is not thought to come with any new symptoms. The same precautions of combating the virus still apply, and that is vaccinations and boosters, mask wearing, hand washing, and social distancing. Other modes of protection the island has against COVID include the monoclonal antibodies and the COVID antiviral pills. Daniel Perez reporting for KUAM News.